7 subtle signs of decline in elderly loved ones you shouldn't ignore. Have you ever noticed a subtle shift in an elderly loved one's behavior or physical abilities? It's easy to dismiss these changes as simply getting older, but sometimes they can be early indicators of a decline in health. While aging is a natural process, certain signs warrant closer attention. In this video, we'll explore 7 subtle yet significant warning signs that often appear in elderly individuals as their health declines. From changes in sleep patterns to unexpected difficulty with familiar tasks, these signals can offer valuable insights into their well-being. Understanding these signs can empower you to provide the right support and care, ensuring comfort and dignity during this stage of life. Stay tuned until the end, because recognizing these changes can not only prepare you emotionally, but also allow for interventions that could significantly improve their quality of life. Whether you're concerned for a parent, grandparent, or even yourself, this information is crucial for anyone navigating the complexities of aging. Now, let's get started. Number 1. Changes in sleep patterns. One of the earliest and often overlooked signs of a decline in health among elderly individuals is a disruption in their sleep patterns. This isn't simply about occasionally having trouble falling asleep. It's about a more profound and persistent shift in their sleep-wake cycle. They might find themselves sleeping more during the daytime and less at night, experiencing frequent awakenings throughout the night, or feeling perpetually drowsy and fatigued even after what appears to be a full night's rest. These changes can manifest in various ways and can significantly impact their daily lives. For instance, consider 75-year-old Eleanor, who has always enjoyed a predictable and restful sleep schedule. She typically retires to bed around 10 p.m. and wakes up refreshed and ready to start her day at 7 a.m. However, recently her family has noticed a concerning shift in her sleep habits. Eleanor now frequently naps during the day, sometimes for extended periods, and she has started to experience periods of disorientation and confusion at night. She often wakes up multiple times before dawn, sometimes struggling to fall back asleep, which leaves her feeling exhausted and disoriented during the day. This noticeable change in her sleep-wake cycle, combined with increased daytime drowsiness, prompted her family to seek medical advice, suspecting that it might signal a deeper underlying health issue. Doctors often explain that disrupted sleep in elderly individuals can stem from a variety of factors. These can include physical discomfort, such as arthritis pain or backaches, which can make it difficult to find a comfortable sleeping position. Side effects from medications, which are common among older adults managing multiple health conditions, can also interfere with sleep quality and duration. Additionally, age-related changes in the brain's natural sleep-wake regulation can contribute to disrupted sleep patterns. The production of melatonin, a hormone that regulates sleep, often decreases with age, leading to difficulties falling asleep and staying asleep. Furthermore, the circadian rhythm, the body's internal clock, can become less precise with age, contributing to irregular sleep-wake cycles. While occasional sleep disturbances are a normal part of life for people of all ages, persistent and significant changes in sleep patterns, particularly those accompanied by other symptoms, can be an early indicator of declining health. It's essential for family members and caregivers to pay close attention to these changes and to discuss them with a healthcare professional. Further investigation can help determine the underlying cause of the sleep disruption and identify appropriate interventions to improve sleep quality and overall well-being. Addressing sleep problems early on can significantly impact the elderly individual's quality of life, reducing daytime fatigue, improving mood, and potentially preventing further health complications. Number 2. Unexplained bruising or slow wound healing. Unexplained bruising or slow wound healing is a subtle yet significant indicator of potential health decline in elderly individuals. While it's true that aging skin naturally becomes thinner and more prone to bruising, a sudden increase in unexplained bruises, especially in areas not typically subject to bumps or knocks, warrants closer attention. Similarly, if minor cuts, scrapes, or even shaving nicks take an unusually long time to heal, it could signal an underlying issue. Consider 80-year-old George, a man who always took pride in his robust health and resilience. He was accustomed to the occasional bump or bruise, considering them a normal part of an active life. However, lately, his family noticed a concerning trend. George began developing bruises on his arms and legs, often without any recollection of an injury. These bruises weren't just the typical small purplish marks. They were sometimes larger and darker than usual, appearing in places he wouldn't normally expect. What's more, these bruises seemed to linger longer than they used to, taking weeks to fade completely. One morning, while shaving, George nicked himself slightly, a minor cut that he would typically dismiss as insignificant. However, this small nick stubbornly refused to heal. Days turned into weeks, and the small wound remained, a persistent reminder of something amiss. His family, observing these changes, began to suspect that something more than just the normal effects of aging might be at play. These seemingly minor changes, the unexplained bruising and the slow wound healing, can be indicative of several underlying health issues. One possibility is a decrease in blood clotting efficiency. As we age, our bodies can produce fewer platelets, the blood cells responsible for clotting, making us more susceptible to bruising and slower to heal. This decrease in clotting efficiency can be exacerbated by certain medications, such as blood thinners, commonly prescribed to older adults. Another potential factor is a weakened immune response. The immune system, our body's defense against infection and injury, can become less effective with age, making it more difficult for the body to repair damaged tissues and fight off infections. This can lead to slower wound healing and an increased risk of infections from even minor injuries. Furthermore, nutritional deficiencies can also contribute to both bruising and slow healing. Adequate intake of vitamins C and K, both essential for blood clotting and tissue repair, becomes increasingly important as we age. A deficiency in either of these vitamins can manifest as easy bruising and delayed wound healing. Therefore, while the occasional bruise or slow healing cut might not be cause for immediate alarm, a pattern of unexplained bruising or unusually slow wound healing, as observed in George's case, should not be ignored. It's crucial for family members and caregivers to be vigilant and to discuss these observations with a healthcare professional. A simple blood test can often reveal underlying deficiencies or other medical conditions that may be contributing to these symptoms. Early detection and intervention can significantly improve an elderly individual's overall health and well-being, preventing potential complications and ensuring a better quality of life. Number 3. Difficulty managing finances or familiar tasks. A significant, often overlooked, sign of decline in elderly loved ones is the emergence of difficulty managing finances or performing familiar tasks. This isn't simply about occasional forgetfulness, like misplacing keys or momentarily forgetting a name. It's about a noticeable and persistent change in their ability to handle routine activities they've performed effortlessly for years, even decades. These changes can manifest in various ways, impacting different aspects of their daily lives. For instance, they might struggle to balance their checkbook, a task they once handled with precision and ease. They might start missing payments for bills, accumulating late fees, or even forgetting to pay bills altogether. They might misplace important financial documents, like bank statements or tax returns, leading to confusion and stress. Even something as simple as following a familiar recipe, a cherished family tradition, might become a challenge, with forgotten ingredients or steps leading to culinary mishaps. Consider 78-year-old Martha, who always managed her household finances meticulously. For decades, she kept meticulous records, paid bills on time, and balanced her budget with unwavering accuracy. Her financial acumen was a source of pride and independence. However, recently, a concerning shift began to emerge. Martha started missing payments, sometimes doubling up on others. Bills began piling up unopened, and she expressed confusion about her bank statements, struggling to reconcile the figures with her own records. She even miscalculated the tip at her favorite restaurant, a simple arithmetic task she'd performed countless times without a second thought. This sudden difficulty managing a task she'd handled effortlessly for decades signaled a potential decline in cognitive function, prompting her family to seek medical advice. These difficulties can stem from a variety of underlying factors, including age-related cognitive changes, medication side effects, or even undiagnosed medical conditions. Sometimes, the changes are subtle and gradual, making them easy to dismiss as simply getting older. However, it's crucial to recognize that these difficulties can significantly impact an elderly person's independence, safety, and overall well-being. Difficulty managing finances can lead to financial instability, jeopardizing their ability to meet their basic needs. Struggling with familiar tasks can erode their confidence and sense of self-reliance, leading to frustration and social withdrawal. Therefore, if you notice an elderly loved one experiencing increasing difficulty with finances or familiar tasks, it's essential to address these concerns promptly. Start by having an open and compassionate conversation with them, expressing your concerns and offering support. Avoid judgment or criticism, and focus on understanding their challenges. Together, you can explore strategies to simplify tasks, provide assistance where needed, and seek professional guidance. A consultation with a healthcare professional can help determine the underlying cause of these difficulties and identify appropriate interventions, such as cognitive assessments, medication adjustments, or support services. Early intervention can significantly improve their quality of life, preserving their independence and dignity. Number 4. Loss of interest in hobbies or social activities. A significant shift in an elderly person's engagement with their hobbies and social activities can be a red flag, indicating a potential decline in their overall well-being. This isn't simply a matter of occasionally feeling tired or needing a break. It's about a sustained disinterest in activities that once brought them joy and fulfillment. They may stop attending social gatherings they previously looked forward to, neglect hobbies they once pursued passionately, or withdraw from conversations and interactions with family and friends. This withdrawal can be a subtle but powerful indicator that something is amiss. Consider 82-year-old John, a passionate gardener who dedicated hours to tending his prized rose bushes. His garden was his sanctuary, a place where he found solace and satisfaction. He meticulously pruned his roses, fertilized them with care, and delighted in their vibrant blooms. He often invited friends and neighbors to admire his handiwork, sharing his knowledge and enthusiasm for gardening. Social gatherings often revolved around his garden, with barbecues and afternoon tea parties taking place amidst the fragrant blossoms. Lately, however, a concerning change has overtaken John. He's lost interest in his beloved garden, allowing weeds to sprout among his roses and neglecting the meticulous pruning that once kept them thriving. His gardening tools, once meticulously cleaned and stored, now gather dust in the shed. He prefers to stay indoors, often sitting by the window, gazing out at his neglected garden with a vacant expression. He declines invitations to social events, even those centered around his garden, preferring the solitude of his home. He shows little enthusiasm for conversations, offering only brief, monosyllabic responses. This withdrawal from his passion and his social circle is a stark contrast to John's previously vibrant and engaged personality. His family, noticing this significant shift, begins to worry. They recognize that this isn't just a temporary phase. It's a sustained disinterest in activities that once defined him. They suspect that this withdrawal might be a symptom of something more profound, a decline in his overall well-being, perhaps related to physical health issues, emotional distress, or even early signs of cognitive decline. The loss of interest in hobbies and social activities can stem from various underlying factors. Physical ailments such as arthritis or chronic pain can make it difficult to engage in physical activities, leading to frustration and withdrawal. Depression, a common condition among older adults, can sap motivation and make even enjoyable activities seem burdensome. Cognitive decline, including early stages of dementia, can affect memory, concentration, and decision-making, making it challenging to participate in complex activities or social interactions. Therefore, it's crucial for family members and caregivers to pay close attention to any significant changes in an elderly loved one's engagement with hobbies and social activities. These changes can be subtle and gradual, but they shouldn't be dismissed as simply getting older. It's essential to have open and compassionate conversations with the elderly individual, expressing concern and offering support. Encourage them to talk about how they're feeling, and explore any underlying physical or emotional issues that might be contributing to their withdrawal. Seeking professional guidance from a healthcare provider is crucial to identify any underlying medical or psychological conditions and develop appropriate interventions. Early detection and intervention can significantly improve an elderly person's quality of life, helping them rediscover their passions and reconnect with their social network. Number 5. Changes in personal hygiene. Changes in personal hygiene can be a subtle yet profound indicator of declining health in elderly loved ones. While occasional lapses in grooming habits might be attributed to simple forgetfulness or a temporary change in routine, a persistent and noticeable decline in personal hygiene warrants closer attention. This isn't about adhering to societal beauty standards. It's about a shift in an individual's ability or willingness to maintain their usual level of cleanliness and self-care. This can manifest in various ways, impacting different aspects of their grooming routine. For instance, they might begin to neglect regular bathing, showering less frequently than they used to, or skipping showers altogether for days at a time. Their hair might become unkempt and greasy, lacking the usual styling or care. They might stop shaving regularly, leading to noticeable stubble or an unkempt beard. Oral hygiene might also suffer, with less frequent brushing and flossing leading to bad breath and potential dental problems. They might wear the same clothes for multiple days, neglecting to change into clean attire. These changes, while seemingly minor, can be indicative of a deeper underlying issue. Consider 76-year-old Mary, a woman who always took immense pride in her appearance. She was known for her impeccable style, her perfectly coiffed hair, and her immaculate grooming habits. Getting ready for the day was a ritual, a time for self-care, and a reflection of her self-respect. She enjoyed trying new hairstyles, experimenting with different outfits, and always ensured she presented herself with elegance and poise. Her attention to personal hygiene was not just about vanity. It was an integral part of her identity and a source of confidence. Recently, however, her family noticed a concerning shift in her behavior. Mary started paying less attention to her appearance. She began wearing the same clothes for days, neglecting her usual hair care routine, and sometimes even forgetting to brush her teeth. Her once vibrant and stylish outfits were replaced by worn and wrinkled clothing. Her hair, once meticulously styled, became unkempt and tangled. The change was gradual but noticeable, a stark contrast to her previous meticulous grooming habits. Her family recognized that this wasn't just a temporary lapse in her routine. It was a persistent decline in her attention to personal hygiene, a subtle but powerful indicator that something might be amiss. This decline in personal hygiene can stem from a variety of factors. Physical limitations, such as arthritis or decreased mobility, can make it difficult to perform tasks like bathing, dressing, or even brushing teeth. Cognitive decline, including early stages of dementia, can affect memory and executive function, making it challenging to remember or prioritize hygiene routines. Depression, a common condition among older adults, can sap motivation and make even simple self-care tasks seem overwhelming. Medication side effects can also contribute to changes in hygiene habits, causing fatigue, confusion, or physical discomfort that makes it difficult to maintain personal care. Therefore, if you notice a significant and persistent change in an elderly loved one's personal hygiene, it's crucial to address these concerns promptly and compassionately. Start by having an open and non-judgmental conversation with them, expressing your concerns and offering support. Avoid criticism or accusations, and focus on understanding the underlying challenges they might be facing. Explore any physical limitations, cognitive difficulties, or emotional distress that might be contributing to their decline in hygiene. Together, you can explore strategies to simplify tasks, provide assistance where needed, and seek professional guidance. A consultation with a healthcare professional can help determine the underlying cause of these changes and identify appropriate interventions, such as physical therapy, occupational therapy, medication adjustments, or support services. Early intervention can significantly improve an elderly person's quality of life, preserving their dignity and promoting their overall well-being. Number 6. Increased forgetfulness or confusion. Increased forgetfulness or confusion, exceeding the typical occasional memory lapses associated with aging, can be a significant indicator of a potential decline in cognitive function. This isn't simply about misplacing items or momentarily forgetting a name. It's about a noticeable and persistent change in their ability to recall information, retain new memories, and navigate familiar situations. These changes can manifest in various ways, impacting different aspects of their daily lives and raising concerns about their overall well-being. One common manifestation is difficulty recalling recent events. They might struggle to remember conversations they had just a few hours ago, repeat the same stories multiple times, or ask the same questions repeatedly, even after receiving answers. This inability to retain new information can be frustrating for both the individual experiencing it and their loved ones, leading to misunderstandings and communication challenges. Another area where increased forgetfulness can become apparent is in recalling familiar names and faces. They might struggle to remember the names of close friends or family members, even those they interact with regularly. They might misidentify people they've known for years, or have difficulty placing faces in context. This can be particularly distressing for the individual, leading to feelings of embarrassment and social withdrawal. Disorientation in familiar surroundings is another red flag. They might become lost or confused in places they frequented for years, such as their own neighborhood, a local shopping center, or even their own home. They might struggle to find their way back to a familiar location, even if it's just a short distance away. This disorientation can be a safety concern, increasing the risk of accidents or getting lost. Difficulty following conversations can also be a sign of increased forgetfulness or confusion. They might struggle to keep up with the flow of a conversation, losing track of the topic or misinterpreting what others are saying. They might interject with irrelevant comments or repeat themselves frequently, disrupting the flow of communication. This can make social interactions challenging and lead to feelings of isolation and frustration. Furthermore, they might exhibit confusion about the date, time, or their current location. They might struggle to remember what day of the week it is, what month it is, or even what year it is. They might misjudge the time of day, thinking it's morning when it's evening, or vice versa. This temporal disorientation can disrupt their daily routines and make it difficult to manage appointments or schedules. Consider 81-year-old David, who always enjoyed lively discussions about current events. He was known for his sharp wit, his insightful commentary, and his ability to recall details from past conversations. He eagerly awaited the daily newspaper and devoured news magazines, keeping abreast of local, national, and international affairs. He relished engaging in debates and discussions with friends and family, sharing his perspectives and challenging their viewpoints. His intellectual curiosity and his keen memory were defining characteristics of his personality. Lately, however, a concerning change has overtaken David. He's struggling to recall recent news stories, often repeating the same stories multiple times, sometimes within the same conversation. He forgets details of conversations he had just a few hours earlier, asking the same questions repeatedly, even after receiving answers. He becomes confused about the date and time, sometimes thinking it's a different day of the week or even a different month. He struggles to follow conversations, losing track of the topic and interjecting with irrelevant comments. This increase in forgetfulness and confusion, beyond the scope of typical age-related memory changes, indicates a potential decline in cognitive function. Therefore, if you notice a marked increase in forgetfulness or confusion in an elderly loved one, it's crucial to seek professional medical advice. A healthcare professional can conduct a thorough evaluation to determine the underlying cause of these changes and recommend appropriate interventions. Early diagnosis and treatment can significantly improve their quality of life and potentially slow the progression of any underlying cognitive impairment. Number 7. Unexplained changes in mood or behavior. Unexplained changes in mood or behavior in elderly loved ones can be a subtle yet significant indicator of underlying health issues, emotional distress, or even early signs of cognitive decline. While occasional mood swings are a normal part of life for people of all ages, a persistent and noticeable shift in their overall demeanor warrants closer attention. This isn't about simply having a bad day. It's about a sustained change in their typical emotional state and behavioral patterns. These changes can manifest in various ways, impacting different aspects of their interactions with others and their overall quality of life. One common manifestation is increased irritability. They might become easily frustrated or agitated by minor inconveniences, snapping at family members or caregivers for seemingly trivial reasons. Their tolerance for frustration might decrease significantly, leading to outbursts of anger or impatience. This increased irritability can strain relationships and create a tense atmosphere within the home. Another concerning change is increased anxiety. They might express worries or fears that seem out of proportion to the situation, or they might experience persistent feelings of unease and apprehension. They might become more withdrawn, avoiding social interactions or isolating themselves from loved ones. This increased anxiety can significantly impact their quality of life, leading to feelings of loneliness, isolation, and emotional distress. Withdrawal from social interactions is another red flag. They might lose interest in activities they previously enjoyed, decline invitations to social gatherings, or prefer to spend time alone rather than engaging with others. This withdrawal can be a sign of depression, anxiety, or even early stages of cognitive decline. Uncharacteristic aggression is another behavioral change that warrants attention. They might display verbal or physical aggression towards others, a behavior that is completely out of character for them. This aggression can be directed towards family members, caregivers, or even strangers, raising concerns about their safety and the safety of those around them. Changes in sleep patterns, often accompanying mood and behavioral changes, can further exacerbate the situation. They might experience difficulty falling asleep, frequent awakenings throughout the night, or excessive daytime sleepiness. These sleep disturbances can worsen their mood, increase irritability, and contribute to cognitive difficulties. Consider 79-year-old Elizabeth, a woman known for her cheerful disposition and her active social life. She was always the life of the party, engaging in lively conversations, sharing stories, and radiating warmth and positivity. She enjoyed spending time with her family and friends, attending social gatherings, and volunteering at her local community center. Her optimistic outlook and her genuine concern for others were defining characteristics of her personality. Recently, however, a concerning change has overtaken Elizabeth. She's become increasingly irritable, snapping at her family members for minor inconveniences. She's withdrawn from social interactions, declining invitations to gatherings she once eagerly anticipated. She expresses feelings of anxiety and worry, often dwelling on negative thoughts and fears. She started experiencing difficulty sleeping, tossing and turning at night, and feeling perpetually exhausted during the day. This unexplained change in mood and behavior, a significant departure from her usual demeanor, is a cause for concern for her family. They recognize that this isn't just a temporary phase. It's a persistent shift in her overall emotional state and behavioral patterns. These changes can stem from a variety of underlying factors, including physical health problems, medication side effects, emotional distress, or even early stages of cognitive decline. Physical illnesses, such as infections, thyroid problems, or vitamin deficiencies, can affect mood and behavior. Medications, especially those with sedative or stimulating effects, can also contribute to mood swings, irritability, or anxiety. Emotional challenges, such as grief, loneliness, or stress, can significantly impact mood and behavior. Early stages of dementia can also manifest as changes in mood and behavior, including increased irritability, anxiety, withdrawal, and aggression. Therefore, if you notice unexplained and persistent changes in mood or behavior in an elderly loved one, it's essential to seek professional medical evaluation. A healthcare professional can conduct a thorough assessment to determine the underlying cause of these changes and recommend appropriate interventions. Early diagnosis and treatment can significantly improve their quality of life, address any underlying health issues, and provide support for emotional well-being. Recognizing these 7 subtle signs of decline in elderly loved ones is crucial for providing appropriate care and support. These changes are not always easy to spot, and it's important to remember that aging affects everyone differently. However, by paying close attention and seeking professional advice when needed, you can help ensure your loved ones maintain their comfort, dignity, and quality of life during this stage of life. Remember, you are not alone in this journey. Numerous resources are available to help you navigate the complexities of aging. We'd love to hear your thoughts and experiences. Leave a comment below and share what resonated with you the most. Your insights can be incredibly valuable to others facing similar challenges. If you found this video helpful in navigating life after 60, please give it a thumbs up. Don't forget to subscribe and hit the notification bell so you don't miss out on our latest tips and advice for enjoying a fulfilling life after 60 all for free. Your support helps us create more content like this to support others. Thank you for watching, and we look forward to seeing you in the next video.